Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at answering the 2018 VCE HHD exam, question 1. Before we dive into question 1, just a reminder, if you subscribe to Health Resources Hub YouTube channel, there's a whole heap of videos already available there that you can get access to, and a new one will come out each day between now and the HHD exam at the end of the year, so if you subscribe you'll get an alert to all those new videos. Please let your other HHD friends know too. I'm running the ACE HHD exam preparation and revision session this year, and so you can book a spot to that at book.acevce.com. You can see our social media links there for Instagram, TikTok and Facebook if you want to follow us and get an alert to each new video that comes out daily, as well as our email if you've got any questions or suggestions on videos you'd like me to work on. So here we are looking at question 1 from the 2018 VCE HHD exam. You'll see question 1 overall was worth 6 marks and 1A was worth 2, and it asks you to outline how life expectancy differs from health adjusted life expectancy. So obviously when looking at questions like this, it's always really important to think about what the command terms are, so it starts there with outline, and obviously it's focusing on how they differ, so it's not really just asking for a description, it's really asking how they're different. So you need to say something along the lines of life expectancy being a measure of the quantity in years that the person is expected to live, if that takes into consideration also current conditions not changing, okay? Whereas health adjusted life expectancy is really measuring the number of years in good health a person is expected to live. And so that's the real contrast that we were looking for in that answer there. You can see that the majority of students, 52%, achieved 2 marks for that particular question. And so often the first question in the exam is one of these kind of description or definition style questions. And so that hopefully most of the time helps to sort of ease you into the paper. Okay, then B, was asking you for 4 marks to explain how changes in policy and practice relating to old public health may have contributed to Australia's health status over time. So I would always tell my students to look at a 4-mark question and essentially think about it as 2 2-mark questions. And so for this particular question here, I'd be trying to give 2 different examples of policy and practice relating to old public health, and then linking those each to a change in Australia's health status over time. So as you're probably aware, changes in policy and practice linked to old public health are things like improvements in access to safe water, improvements in sanitation, as my little kitty cat walks across the screen here, improvements in things like quarantine, nutrition. So you could have chosen any of those particular examples and then tried to link that into an improvement in Australia's health status over time. And so that improvement in health status could have been an increase in life expectancy, a decrease in infant or under 5 mortality, or a reduction in burden of disease for particular conditions such as infectious diseases. And so you can see underneath there, it's giving you an outline that this particular question was not done particularly well by students, with only 17% of the students who sat the exam achieving 4 out of 4 for this particular question. You can see there in the exam report it gives you some examples of some common errors, and it mentions there that often students gave examples of the new public health rather than the old public health. And so that's just something to keep in mind to make sure you've got at least two clear examples of the policy and practice relating to old public health ready for when you go into the exam. Okay, hopefully you found that video useful. We'll be going through the questions from all of the past exams over the next few months. So as I said, make sure you subscribe to Health Resources Hub YouTube channel to get a useful video like this each day. Come along and see me at the ACE HHD exam preparation and revision session at book.acevce.com. There's our social media and our email. Thanks so much.